नमस्कार, आप सभी का हार्दिक स्वागत। We would like to welcome you all on behalf of Independent Research Ethics Society, AYUSH Samriddhi International Webinar Series at the milestone of 2239. Thank you for your overwhelming support, mentorship, guidance, and active participation, due to which this journey continued up to infinite. Thank you again. I would like to welcome Dr. Dilip Kumar Goswami, Professor and Head, Agat Tantra USTM Meghalaya from Guwahati, Dr. Nitin Urmalia, Professor and HOD, Agat Tantra and Nasha Mukti Kendra, Government Ashtanga Ayurved College, Indore. Thank you, welcome both of you. And today's topic is very unique. Whatever Ayurveda says regarding diagnostic criteria of poisonous white, and are they relevant to this present era? Thank you, Dr. Dilip ji, for suggesting this topic to us. Thank you very much. Thank you, Nitin ji, for your joining. Thank you very much. Now I would like to invite डॉक्टर दिलीप गोस्वामी जी। मैं दिलीप गोस्वामी जी को सादर आमंत्रित करता हूं।
नमस्कार। So this is my first appearance in the platform as a speaker, though sometimes I was privileged to attend the sessions, but it was not possible to attend most of the sessions due to some other duties. So I am feeling myself privileged to be on this platform with Dr. Nitin Urmiliaji and the Professor Sharmaji, and I hope with this short presentation I shall be able to open some new, not new actually, the concept is old, but I think we should think in the modern light, and we should be courageous and confident enough to say that we can do something. Because till now, Ayurvedic toxicology, Agat Tantra, is, I think, remaining in such a state that we cannot claim that it is a practical subject, and in most of the times we fail to diagnose or stand with the cases that are coming to us with the poisoning. So, my topic is very simple, and I am going to tell about the Ayurvedic criteria by which we can differentiate the different types of bite cases. In most of the times when we are in our clinic or we are in our hospital, we face many types of bite cases, especially the Jantu Dangsha, animal bite cases. The most common is, I am giving some examples, photographs, you know all. The most common and frequent one is the dog bite. Most of the patients come to us with the dog bite, and the next percentage, especially in our area, the monkey bite. Monkey bite is common because in our place now, in Guwahati especially, many monkeys are moving on our courtyards, and when they get any fear, they attack us. And the third one I have experienced is the cat bite cases. Cat nail scratch generally happens, but the cat bite is, I think, not frequent. Like the dog is the best, most one, then the monkey, then the cats. Then next, please, sir. So next, sometimes we also suffer from the next, please, sir. So we sometimes also suffer from the bites of the as they remain in our houses, rat bites, mice bites, sometimes the mongoose bites. So this happens. And when we consider about the animals in the very rare stage, sometimes there may be some bite with the rabbit, and also sometimes now it is the very rare fox, the jackals, sometimes even there may be some bite by some animals like the lions, wolves, etc., etc. So these are the common animals. These are the common jantus that can bite the persons, and the persons come to us with their request for treatment. And when any case come to us nowadays, as it is being the protocol notification of the government, the health department, it is a common instruction that whatever may be the bite, when any case of bite will come to you, I am not going to discuss about the snake bite. It will, if time will permit, in other sessions we shall try to discuss. So in all, it is a standing instruction that we have to give the anti-rabies vaccines, and immediately there should be wash. We have to wash the injured part. Then we have to give the TT, tetanus toxoid, and the anti-rabies vaccines. We do when randomly, when any patient come to us, we give it. But when we go to the Ayurvedic classics and the application of the agodas and the treatment of the especially the alarcobicious, it is observed that we should first diagnose whether it is a Visakta dangsha or Nirbisha dangsha. If it is a Nirbisha dangsha, if we shall give the agodas and if we shall go to install the alarcobisha sikitsa, then it will create other problems. Even in the agoda application, it is advised that if the bite, the poisoning, there is no poisoning, if we shall use the agodas, then it will create some other problems which will again need some other managements. So at the time of use of the agoda, we should always be cautious. So in now, suppose in the modern classics, till now it is not found that very well and demarcated description about the Visakta dangsha are mentioned. But in the Ayurvedic classics, especially Soraka and Sushruta, has very nicely discussed about the criteria of the signs and symptoms of the Visakta Jantu dangsha. And with that, we can differentiate whether it is a Visakta dangsha or it is a Abhisakta Nirbisha dangsha. And so, as the Ayurvedic classics say, I am to highlight this thing that when the patient will come to us, to an Ayurvedic doctor, especially with any type of Jantu dangsha, animal bite, we are to discuss, we are to classify whether it is a Visakta dangsha, poisonous bite, or it is a non-poisonous bite. And if it is a non-poisonous bite, then we have to give the Shuddhabrana Sikitsa. For that, no other type of treatment is needed. Since it is an injury, we have to treat the injury, whatever may be. We can follow the principle of the modern treatment or of the Ayurvedic treatment principle also. But if it will be asked how we can differentiate the poisonous bite and non-poisonous bite basing upon only the Ayurvedic knowledge, then I can confidently say that there are the criteria are mentioned by the Acharyas in their Samhitas clearly how we can diagnose the poisonous bites. I am going to memorize the things, recall the Samhita, Soraka Samhita, Sikitsastan 23, 177, 178. He has very nicely described that if it is a Visakta Jantu dangsha, there will be Generally, there may be immediately feeling of some itching. In due course, it will increase. Then there will be some feeling of uneasiness at the site of the bite, like pain of pinching pain, pinching character. There will be immediately, there will be some abnormal color, discoloration of the part. The person will lose the sense around the bitten part, and if we shall observe, in inspection, we shall see that the part is, in comparison to the other parts, the part is more and more dirty like. So in this case, we can say that there is definitely some bisha. Bisha may be of any type, and the person should be treated in the line of Bishakta Dangsha Chikitsa. Next, please, sir. Then there will be, it is a very interesting thing, Nikunchana. Nikunchana is also mentioned here. Nikunchana is nothing but the squeezing, like feeling of the part. The person will feel some squeezing movement at the part, which is an important thing, important sign that there will be muscle irritation around the bitten part. Dangshabadharana, in due course, there will be a blasting of the part. This means the bite part will not be healed. Rather, there will be some expansion of the bitten part. Then spota, due to the bisha, there will be appearance of some blister-like appearances surrounding the part, the injured part. Karnika, there will be some elevation surrounding the part. The periphery of the bitten part will be elevated. Mandala, it may be local sign or it may be sarbodohic sign also, generalized sign symptom also, due to spreading of the poison in the whole body. So there may be different types of, like, it may be different types of skin eruptions in different parts by the side of the injury or some distant part of the body. Then jara, it is a sarbodohic lakshana. Jara, we know that it is a good and first important sign of any type of infection, which we can say that this is a bisha, that is a poison. When there is any poison, any toxin in the body, there is a rise of temperature. It is a spontaneous activity, reaction of the body. Next, sir, please. These are the appearances. The jara will be there, sarbodohic lakshana. Sir, next, please. And in the Sushruta Samhita, I am not taking much time. So, because after that, there will be again Dr. Urmiliaji will say. So, in the Sushruta Samhita also very nicely described about the Bisakta Jantu Dangsha. But Sushruta's description is seemed to be, I am not going to discuss here in detail because I think time may not permit, and I was also hurry in preparation of the today's speech. So Sushruta has given an elaborate, more elaborate description because he also described the character of the blood and the bleeding. He said, Krishna Rakta Srava. Krishna Rakta Srava, if from any bitten part, there will be blackish colored discharge, Raktas bleeding, then it should be considered that it is a poisonous bite. And it indicates there is some poison, there is some toxin in the blood mixed. And he also said that Ati Rakta Srava, even with application of the measures, the treatment procedures, it becomes difficult to stop the bleeding. If it is a poisonous bite, the bite becomes more and more spurious. The more bleeding will be there, and even the effort to stop the bleeding may not work immediately. It will take more and more time, because when there will be any toxin, any poison in the blood, the coagulation capacity of the blood will reduce. And also, Sushruta has given a good number of the physical appearances, sarvadaihic lakshanas, and especially in case of the Sarpavisha, we shall discuss. Definitely, we shall be able to discuss in other sessions. So I think very briefly I have told here my feelings, expressed my feelings, because all are the experts in the different fields, and especially in this session, the Agada specialists are there. So we should try to explore all these things and should try to explain in the modern language by following the modern protocols to establish the Agat Tantra principles, because these are very important, and we should show the scientific society that the Ayurvedic classics are not behind the modern classics, especially in the diagnosis. In the treatment line, there are some problems which should be discussed in different forms and which should be tried to eliminate. Whatever may be, I hope this is a very short thing, short points I have told to you. With many, many thanks again, I conclude here. Hope we shall meet again in future with more and more time. Okay, sir. Thank you, sir. Thank you. Thank you.
Thank you very much. I would like to request you to join. It will be pleasure. And now
Definitely,
I
sir.
would like to request Dr. Malia ji. He has enough half an hour, so he can guide us on poisonous bites.
Yes,
Dr.
sir.
Nirmalia.
Yes, sir. Thank you, sir, for giving me opportunity to share my views about poisonous bite in this platform. I'm again thankful to you, and now I'm also thankful to Goswami sir. He covered lots of things about poisonous bite. So whatever remaining is there, that I will try to cover, because sir told me we have 30 minutes. That is more than enough. Actually, here, what is the problem? I am also outside of the city. I am just traveling. Behalf of the just favor of Pawan sir, just I was ready. So I will try to my best. So here actually poisonous bite is very common nowadays. Not nowadays, in ancient time also. So in we can see the importance of poisonous bite in the definition of Agat Tantra, told by explained by Susutachar. He told Agat Tantram नाम सर्प कीट लूता मूषकादि दष्ट विष व्यंजनार्थम विविध विष संयोगो उपशमनार्थम च. So there are lots of poisons in our society, but among them he highlighted just animal bite firstly, because Agat Tantram naam Sarp Keet Luta Mushkadi. After that, he explained about the Garvisha and different type of Visha. So we can understand the importance of poisonous bite as per the reference. So this is the main factor. And second more factor is there. There is one common factor. Suppose that we are in the clinic and patient came and he told, I don't know which type of poison, yeah, poisonous animals has bitten me or not. He is not confirmed. He is not sure, but he is have some features. So as per the features, we can diagnose he is the patient of Sthavar Visha, he is the patient of Jangam Visha. So there is some common features like that in Sthavar Visha. Suppose that one patient has suffered from vegetable poison, then he has features Sthavaram tu Joram Hikam, Dant Harsh Gal Graham, Fein Vam Aruchi Shwas, Murcha Cha Janyet Visham. So that means there will be feature if in vegetable poisons there will be features like Joram Hikam, Jwara Hikka, Gal Grah, Murcha, like that. So in suppose that that patient bitten by poisonous animals, then there will be symptoms different. Nidram, Tandram, Klamam Daham, Sapakam Lom Harshanam, Sofam Cha Atisaram Cha Janyet Jangamam Visham. Very nice line. And also I have completed my thesis in pit viper bite. in that time I have observed many features whatever is common in that time. So as per ethical committee, I had restrictions about mild poisonous. We can't take severe poisoning conditions. So in that conditions I have observed there is one common features in snake bite, that is edema, that is show. So nidram tandram klamam daham. Nidra, Tandra, Klam, Daha, Sapakam. There is one wound with suppuration. And after that, Sofam cha Atisharam cha. There will be some edema with diarrhea. So if these symptoms are common in patient and he has no identity of vegetable poison or animal poison, then we can confirm by these symptoms. So this is the main criteria for diagnosis of poisonous bite or diagnosis of vegetable poisons. And second, another thing is there is adhisthana. There is 10 adhisthana, 10 source of sthavar visha, and 16 sources are present in animals. So among the all animals, that spider is very common. He has more than eight, sorry, seven sources. He has seven parts in his body. By these contact we can be poisonous, we can get poisoned. So luta is very common, that is very common. And after that there are many adhisthana like drashti, niswas, spars, danstra, नख, मूत्र, पुरीश, शुक्र, लाला, आर्तव, मुख, संदंस, विसर्धित, तुंडास्थि, शूक, पित्त शूक, शवानीति. Even though the dead body of a snake is also a one of the factor for poison, we can't ignore it. We can't just ignore it, because suppose that there is a dead body of poison, sorry, snakes, then and we are taking some foods and something any other things from that same area, so that will be poisonous. This is the clear cut reference. So after the death, snake is also a common, he is a poisonous. In living he is a more poisonous, in dead he is a mild poisonous, we can say. So after that come into the Agat Tantram of SERP. SERP we have discussed. In the most common factor in snake bite is edema. I have observed in my thesis time. Suppose that a patient has bitten by 7 o'clock, then till then 7:30 there will be more edema in bitten area. There will be more sofa we can diagnose. We have to compare these swelling by the compare of normal legs. Generally bitten area is lower part of the leg. Because of the gardening and something, we are not just focusing on whatever animals are just there are available or not, present or not, we can't see. So in that tolerance, the chances of poisoning of insects and poisoning of spiders and poisoning of snakes are more common in that area. So I have observed in that time within half an hour we are getting a more edema in one leg, bitten leg. So in compared to other common normal leg, the area whatever edema is there, suppose that edema is more, then this snake is more poisonous. He has exhausted, expelled more poison in the bitten time. We can diagnose like that. So same criteria we can another. Here is one exceptional case is there. Suppose that one patient is bitten by crate. So there will be nothing features. There will be no edema, there will be no itching, there will be no burning sensation. But a patient will be in the severe condition. He can get more, or otherwise he will be towards death. So we can't ignore it this type of. So in anyhow, if we have any doubts, we have any special features, then in this time current time we have to protect the dead patients. So by this we have to apply ASV, anti snake venom. This is the most common drug, most common vaccines nowadays available that we have to use. In my thesis time, in my research topic, I have also covered many patients as per the inclusion criteria and as per the guidance of ethical committee. But mild poisonous case I can take. But if there is some little bit moderate or severe, I am unable to take that patient. In that time, we have to apply ASV, anti-snake venom, regularly within half an hour, half an hour, half an hour. We have to apply 4 5 times anti-snake venom because we have to protect the patient. No, we can't do any experimentation in that time. So this is the one of the most common features. स विषय तुदतः ग्रंथितः कंडू शोफ रुजान्वितः. This is the common features of poisonous snake bite. Now come to the kita. Keet means insect bite. There are reference of 67 types of insects mentioned in Agat Tantra and also elaborated by Susutachar. Mainly Agat Tantra is explained more deeply by our Acharya Sushut. So he has explained 67 types of kita. One of them is mashak. Mashak means mosquito. Little bit mosquito can induce the swelling in that bitten area. We can observe, and there will be more itching. In so itching and edema, little bit edema is more common in poisonous mosquito. For that example, we can take this one also Anopheles mosquito. This we can take because that is also toxic because of Anopheles. Same like next is Makshika. We can take bees, housefly, honeybee. So there is more poison in honeybee also. They can sting if we are just irritating him, and if we are just towards the getting honey and some process we are doing like that. We are just hitting his comb, bomb, whatever by stick and something. Then they will, if they will irritated by our activity, then they can bite, and there will be more poisons in the honeybee. So same like kita, honeybee also we can see. Next is galgolika, that is lizard. Lizard is also poisonous. He is come under the category of insect. So by the bite of lizard, there will be more burning sensation, more swelling like that, and more itching also. Hypersensitivity can be developed by due to the this one bitten by galgolika lizard. Same crocus are also bitten by chameleon. We can get poisoned. So there will be same like features as per lizard. And also there is some reference of toad fish, sorry, poisonous fish. So there is some poisonous fish. Verti is one of the example. If we are taking vertifisha with his bones and something, then that will be more poisonous in compared to other visha, other fishes. So we have to aware about the verti like that. So same pattern, we have some toads also, we have some leeches also. So there are more hypersensitivity, more poisons in their blood, and whatever they just expelled in our blood, and also there will be chances of hypersensitivity. Due to hypersensitivity, there will be more chances of allergic manifestations, and after that we can lead to the death also. So serp keet. Now come to the luta. So luta, previously I have told you there are more 8 ashrayas made adhisthana in one single animal bite, that is spider bite. So in spider bite we can get 8 adhisthana. His mutra also poisonous, his puris is also poisonous, his lala is also poisonous, his menstrual blood is also poisonous. Everything is poisonous. Is also poisonous. So we can't ignore. And I have seen many severe patient of spider poisoning because in Kerala they have the trend to just wear the lungi in his lower regions. They are not wearing shirt, t-shirts like that, and they are just doing gardening in tea plants, in any other plants. So in that time, sometimes spiders hidden in that plant, and then spider jumped into in his chest or abdomen and bitten many times. So there are more blisters. I have seen that cases, very severe cases I have seen in that time. So there are many papules and vesicles, blisters, we can see. And after that, if we are rupturing, and by automatically they are just ruptured by touching and something, there will be more itching and more burning sensation in there. So patient is not comfortable to just go for sleep and go for a normal activity. That I have seen many times. So this is spider is also a very risk factor. So there is a one sequence, there is 7 days cycle, 7 days steps. If bitten by spiders, suppose as one patient has bitten by spiders, then first day there will be nothing, only redness something. Second day there will be prominent redness with itching. Third day there will be some blistering something. Fourth day more blisters formations. Then fifth day more pain in that area. Sixth day more bleeding and sorry main burning sensation with papules and pain, like that. So there are 7 days sequential symptoms mentioned in our classic reference. So same pattern, we have very interesting drugs. And here one of the main important thing is, if we have diagnosed the visha, that is jangam visha, sthavar visha, whatever visha, gar visha, dushi visha, we have to give agda. If by agda we can neutralize that poison, that toxicity, we have to neutralize. If we are doing symptomatic treatment, we are not giving any antibiotic, sorry, antidotes, that means agda, then there will be less chances of curing or successful treatment. So we have to observe many times. If there is poisoning, then we have to give special agda, special antidote in that condition. If we are not giving, then there will be less chances of permanent cure. We will get relief by symptomatic relief, we will get as per symptomatic treatment, but we can't cure that illness, that is that toxicity we can't cure. So that we have to remember every time. If there is patient is suffering from animal poison, then we have to give agda. If suffering from this sthavar poison, vegetable poison, then we have to give agda, special agda. So in common agdas we can say vilvadi agad, vilvadi gulika is very common in animal bite. This is also available in nowadays, prepared by South Pharma, only by South Pharma. In North Indian Pharma, they are not preparing this drug, this formulation. So in Ayurveda Sala by Ayurveda Nilayam, Ayurveda pharmacy, like that, many pharmacies are there in South area. So they are preparing Vilvadi Gulika. That is best antidote in any type of animal poisoning. His reference is also Visuchika Jeen Gar Jorash Anjanai. That means we can use in any type of poison, also in Garvisha, also in Dusi Visha, also in Luta Visha, also in Sarv Visha, also in many Vrashik Visha. We have to give Vilvadi Gulika. This is the main fact. Now come to the Vrashik Visha. So suppose that one patient suffered bitten by a scorpion. Then scorpion has main specific features. There will be more burning sensation in that area, like अंगारे आग की अंगारे के समान बहुत ज्यादा उसमें जलन होगी, बहुत ज्यादा severe burning sensation. We can there will be manifestation of severe burning sensation we can see in scorpion bite. And also then another feature is pain, then another feature is swelling, and swelling will be go upwards. to backwards. So that we have to diagnose. This is the case of scorpion bite. This is the case of spider bite, like that. Because if we are not able to diagnose properly, we can't give proper antidote. Suppose that we have diagnosed a spider bite and patient was suffering from scorpion bite, then there will be wrong treatment and there will be more toxicity in that area, in that bitten area, and also in all over the body. Poison will be spread all over the body. So this is the main thing we have to remember. Diagnosis is very, very important. And here in Kerala, I have seen lots of patient come with the snakes, because suppose that snakes has bitten rapidly, then they just protect ourselves by hitting by stone, by sticks, by they just hit the snakes many times. And snakes, after getting dead body, they come with the dead body of snakes. So that is very easy for us, because this is the mild case of pit viper, this is the mild case of vipers, like that. This is the Russell's viper case, this is the Crate vipers Crate case. So we can diagnose very easily. So in that time we can sure about our treatment plan, treatment principle. So this is the very important. We have to diagnose properly. So in scorpion bite, one of the more common drug is Dashang Agad. We can give Dashang Agad for the best treatment as external application. And one more drug is there common is that is Shigru Punarnavadi. If there is more swelling in that area, then we can apply externally Shigru Punarnavadi. That is also the one of the formulations prepared, manufactured by South Pharma, not by North Indian Pharma. So they, because there are cases as more in nowadays, and they are running very successful Vish Chikitsa Kendra till now. In modern era, they are running successfully, they are treating all the cases. I have seen that features, that everything they are managing by simple medicines, by they are managing any severity. And if a patient is very severe, then they are not taking any risk, they are giving anti snake venom. So this is the common treatment plan in Kerala, something. So scorpion bite, we can give this one, Dashang Agad. So Sarp, Keet, Luta, Mushikadi. Then Mushikadi one is poisonous mouse. Also, there is one factor. In my, as per modern, we can see there are two types of bacteria that is present in that poisonous mouse. So that is Spirobacter and Spirochete, like that bacteria. So anyhow, we have to manage that condition is also by our special agdaj, mushik vishari agda, like that, aku parni, like that, very ankolotar mulambu, lots of antidotes are there. So that antidotes we have to apply, and simple formula is there in agat tantra. If we are suffering from animal poisoning, then we have to apply, we have to take the vegetable poison. If we are suffering from vegetable poisoning, we have to apply the animal poison. Very simple formula, and this is very correct, because I have seen many cases in scorpion bite, they are managing by arc patra. So arc Swed, by they are managing by arc Swed, very drastic, because Sweda is contraindicated in any poisoning cases. But we can give Arnal Dhara and arc Patra Swed. Very even my best friend also have his thesis topic is same like that. Arc Patra Sweda, application of arc Patra Sweda in scorpion bite, like that, in Vrashik Dansa. So there are very unique formulations and unique procedures in Kerala. I am just not highlighting Kerala, because I have done my PG from Kerala. Actually, that is true. There is a very special OPD for Vishchikitsa Kendra, and very special protocols and very special formulations that is also available there, that I have seen many times. 3 years I have observed many times. So this is the common we can see. So Sarp, Kit, Muta, Lushikadi, Mushikadi, Anark Vish. Now last is Alark. So Dilip sir explained too much about Alark Visha, and in Alark Visha also we can manage by our classical reference. One of the common is a Sarpunkha yoga that mentioned by Susut, explained by Susut, that also we can apply. But here is the difficulty. If there is some features like dog in a patient, we are just seeing, I have heard about some features like dog. So in that condition, we have to ignore all the Ayurvedic and something. We have to apply only vaccination. That is a little bit 7 days vaccinations that we have to do. Previously, vaccination duration was 14 days intra abdominal. Now that changed. So we have to apply in that condition because we are now living in modern era. So we can't just doing experimentation on in this era because we have substitute. So there is no need to worry about something. We are just trying, we are experimenting something. So our formulations we are doing, but if we are not getting enough result, sufficient result, then we have to apply mainly last whatever protocol is mentioned in that poisoning. So that is must. So ASV is common, and same like rabies vaccines is also common. We can't ignore it. This is modern medicine, okay, but here the protection of life is very very important in compared to just doing experimentation and something. We can't do any experimentation in this condition. And here one of the another key visha is pipilika visha. पिपीलिका मीन्स जस्ट चीटी जिसको हम कहते हैं. So pipilika visha is also mentioned in our Susuta Samhita, and there are 6 types of pipilika. So in that, some pipilikas are just leading to death. So we have to protect our body as per the type of insects. So these are the features, and we have a special protocol, we have special medicines like that. That is very cheapest. And here again, I will repeat my word. Any poisoning, if we have in Indore, this is common. So suppose that any poisoning animal bite cases we have, then we have to apply externally and internally Vilvadi Gulika. This is the common phenomena, very easily available now in the days here. In any medical store, they are maintaining every pharmacy product and something. So we have to apply this one. And in insect bite and something like that, we have to apply Dashang Agad. Dashang Agad we can apply. And again also some, there is more swelling in by snake bite, by scorpion bite, by spider bite, any type of swelling is there, then we have to apply Shigru Punarnavadi Yoga. That we have to apply. And one of the main thing here, one different thing I have to say, that rice water. Suppose that one rice we have collected, then we have to pour it into some plenty of waters, and we have to just left him for 24 hours, 12 hours. After that, that water we can apply in swelling area, edematous area. There will be less edema, there will be less swelling due to the rice water. So Tandulodak is also a very very nice effect on edema. So that we can say, we can't ignore it. So here one best combination is there is when swelling, then we have to apply Shigru Punanavadi yoga with rice water. Then we have to pour this one churna, Sigrupunanadi churn in rice water, then apply on the bitten area. Then there will be very nice result, tremendous result we will get. This is the sure. So this type of references we have, and one of the main things is here in Kerala, which Chikitsa Kendra is now running. Very nice result they are giving daily, day per day. So this is the very very important. Actually here I have some recommendations that type of visa expert should just invite for the webinars, for seminars, for workshops, like that, to spread his knowledge to all over the India, because they have limitations. They are covering any type of cases in that area, Kerala. But is that cases we are getting in North India, in somewhere in Gujarat and Punjab and somewhere, then they are not able to manage. They are just applying modern medicines. So it's our duty to just highlighted these type of talented teachers, Vishwadyas, and they will share his knowledge with all our colleagues and all our new fresh students, so that we can do something better than our past. And also we can manage many poisoning conditions nowadays with the help of that knowledge. Because I have seen one of the example I will give you. Suppose that one patient is have some edema and some itching, burning sensation, like that. They apply simply yoga symptomatic treatment, punarnavadi gugul with amrtotram kasayam. They just applied internally. Externally, Shigru Punanavadi with rice water they have applied. And somewhere they have applied Jeev Raksha Gulika, Tarun Bhaskar Gulika, Mrat Sanjeevan Agada. Mrat Sanjeevan Agada is nowadays one of the product in South pharmacy. So they are just applying same thing like that. So this is a very nice opportunity. They have expertness in their field, which chikitsa. So it's our duty to just gain knowledge from anywhere, whatever we can get. So it's our duty to just approach him and invite him for many seminars and many workshops and webinars also. Webinars is very convenient in compared to seminars and workshops. So it's our duty to just highlight to him. And there is one important thing is there is one Garvish Visheshagya. That is in Malayalam we can say Kai Visha expert. Kai visa expert, so they are managing any type of gar visa. Suppose that anybody has suffered from gar visa, then they can manage by total pure Ayurvedic methods, by principles, by formulations. They are managing successfully as per the family history. His father was the expert, Kai Visha expert, and his son is also expert. Then his son is also expert. Traditionally they are just following. They don't know the scientific validation of that things, but they know how to manage. That is the common. So traditionally knowledge, too much knowledge with they have, that's our duty to just cover. Now I think I have covered all times. Now I am thankful to all of you for your patience and silence. This topic is very vast. I can explain many things anytime, anywhere. But due to limitations, there is another session. So I am just quite silent now.
Thank you, Dr. Nitin. Very nicely explained. One circular is also out from Government of India, white
Yes.
strings for MO. This is definitely useful for Agar Tantra experts.
Yes, sir. Yes, sir.
Common animal, cat, rats, peridomestic, cow, buffalo, sheep, goat, pig, donkey, horses,
Yes.
wild fox, jackal, monkey, mongoose, bears, rarely reported bats, rodents, birds, squirrel. ये
Yes.
बड़ा प्यारा एक उन्होंने बनाया कि इमरजेंसी केयर कैसे करना चाहिए जहां
जी
जहां
जी
की
जी।
जिसकी है। यदि कॉमन है तो बाइट्स फ्रॉम इन्फेक्टेड एनिमल, licks on broken skin, स्क्रैचेज, या रेयर है इनहेलेशन से भी, ऑर्गन ट्रांसप्लांटेशन से भी, इंजेक्शन से भी, सेक्सुअल से भी। ये कुत्ते की यदि बात करें तो रेबीज की भी डिटेल है। मैं डिटेल में नहीं, कभी बात होगी, ये तो ओवरऑल मैं बता रहा हूं आपको। लेकिन ये मेडिकल ऑफिसर्स के लिए इमरजेंसी केयर को, मुझे अच्छा होगा कि हम लोग इस मंच के थ्रू इसको भी कम से कम अपने अगर तंत्र वाले विशेषज्ञों तक और टीम तक पहुंचा पाए। पूरी की पूरी
बिल्कुल सर।
पैथोलॉजी है। एनिमल बाइट मैनेजमेंट, मेडिकल इमरजेंसी, वुंड मैनेजमेंट, डूज, wash the wound with running tap water, wash the wound with soap and water, apply disinfectant, biological, immunoglobulin and depth around the wound category 3 exposures. Suturing is only if required. 1 2 loose suture, ज्यादा बड़े सूचर इसमें नहीं लगना चाहिए। ये कॉन्सेप्ट।
जी 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 जी।
एंटीसेप्टिक में इनने बताया, इमरजेंसी में डिटॉल भी बताई, सेवलॉन भी बताया, अल्कोहल भी बताया, पोविडोन आयोडीन भी बताया। वुंड मैनेजमेंट, कभी टच मत करो वुंड को हाथ से। सॉइल, चिली, चौक, बेटल लीव्स, स्यूचरिंग मत करो ज्यादा, कैप्चर कॉटराइज मत करो, नो एक्सपोजर। मतलब एक ब्यूटीफुल एक गाइडलाइन तैयार है आप लोगों के लिए कि इमरजेंसी में हमको बाइट एंड स्ट्रिंग्स का क्या करना है, कैसा एनिमल है। मैं ये केवल एक झलक दिखा देता हूँ जिससे हम नेक्स्ट वेबिनार में जा सकें। सीवियर
बिल्कुल सर।
एक्सपोजर है तो क्या है, सीरियस एक्सपोजर है तो क्या है, ट्रांसडर्मल इंजरी, lacerations on the scalp, extensive lacerated bites on the face, just see what examples they have. Or approach post exposure prophylaxis, management of animal bite bound, passive immunization, rabies immunoglobulin RIG, active immunization, anti-rabies vaccines,
Yes sir. Sir,
infiltration,
sir, one of the request I have, you can
big
share this slide to
infiltration,
me and I will
intradermal
explain everything.
ARB, intradermal regimen for post exposure treatment is approved by WHO, cost effective भी है और नर्व टिश्यू वैक्सीन को रिप्लेस भी कर रहा है। इंडिया में सेफ्टी इफिकेसी हो चुकी है। तो ये इंट्राडर्मल रेजिमेंट्स फॉर पोस्ट एक्सपोजर ट्रीटमेंट, अपडेटेड थाई रेड क्रॉस शेड्यूल जो है वो बिल्कुल अलग अलग बताता है। 0.1 ml आईडी साइट, इंजेक्शन कैसे लगाना, किस साइट पे लगाना, शेड्यूल क्या होना उसका, 02 037 28,
Yes sir.
इंट्राडर्मल एडमिनिस्ट्रेशन ऑफ एआरबी। तो एक यदि हम टेक्निकल देखेंगे, ये गाइडलाइन आप लोग जरूर डाउनलोड कीजिए। ये NHSRC इंडिया इस ऑर्गेनाइजेशन का है। तो पूरा का पूरा एक डिटेल बताया कि हमें घबराने की जरूरत नहीं है, किसकी कितनी डोज है, क्या रिमेम्बर करना है, वैक्सीन कैसे देना है। स्नेक बाइट, फिर आई डॉग बाइट के बाद स्नेक बाइट। स्नेक बाइट के डिटेल दिए बहुत, एक एक घंटे का मेरा ही हो जाएगा लेक्चर, नहीं तो वो डूज एंड स्नेक बाइट, फर्स्ट एड फॉर स्नेक बाइट, राइट, reassure, immobilize, get to hospital, tell signs। तो ये डू इट राइट, RIGHT। तो ये इनका एक फॉर्मूला है जो स्नेक बाइट में काम आना चाहिए। 70% नॉन पॉइजनस होती है, नॉन वेनमस होती है, 50% जो है वो वेनमस स्नेक से, बाकी सब ड्राई बाइट है। ये कटिंग, सक्शन, टर्निकेट्स, वॉशिंग द बोन, नेटिव ट्रीटमेंट, ट्रेडिशनल हीलर। अब ये लिखता है बंदा, यहाँ पूरे अगत का धूल कर देता है। ये देखिए NHSRC जहाँ लिखता है अवॉइड ट्रेडिशनल हीलर्स। अब मैं नहीं जानता उसमें आयुर्वेद वाले भी हैं कि नहीं। तो ये पूरा का पूरा एक है, साइन एंड सिम्टम ऑफ स्नेक बाइट। बहुत शानदार प्रेजेंटेशन है। रिस्पॉन्स टू नेगोस्टिमाइन, 20 मिनट WBCT,
Sir, please just share to
प्रिवेंशन
me.
ऑफ स्नेक बाइट। बेयर फुटेड मत चलिए, टॉर्च लीजिए, स्टिक लीजिए, एनिमल फीड और रवेश अपने घर से दूर रखिए, स्लीप ग्राउंड पर मत स्लीप कीजिए। अब ये पॉसिबल है क्या किसी के लिए? फिर स्कॉर्पियन स्टिंग, इसके बाद स्कॉर्पियन की स्टिंग की पूरी ऐसे ही ट्रीटमेंट की एसओपी है जो गवर्नमेंट ऑफ इंडिया ने मेडिकल ऑफिसर्स के लिए जारी की है। मैनेजमेंट ऑफ ये स्टेज 1, स्टेज 2, स्टेज 3, स्टेज 4। इसके अलावा वो जनरली इसमें एएसबी प्लस प्रोजोसिन ज्यादा दिया है। प्रोजोसिन के बाद अगर प्रोजोसिन ही है 5 में भी 12 घंटे बाद भी हनी बी, बम्बल बी, येलो जैकेट, हॉर्नेट, रेड एंट, ब्लैक जैकेट, पेपर वास्प, ये कितने सारे कीड़े हैं। ये जो भी है, टू कंक्लूड एनिमल बाइट मैनेजमेंट इज मेडिकल इमरजेंसी। केस भी दिए हैं इसमें। तो आप, मुझे रिक्वेस्ट है, जो भी यूट्यूब के दर्शक इसे देख रहे हो या आप लोग जो सुन रहे हैं, ये जरूर अपने अगत तंत्र के टीचर्स और स्टूडेंट्स में डिस्ट्रीब्यूट करें इसको। ये मेरी आपसे प्रार्थना है। थैंक यू वेरी मच।
जी थैंक यू सर।
नितिन जी,
जी जी सर।
कैसा
सर
रहा?
थोड़ा मेरी रिक्वेस्ट थी कि बहुत शानदार सर, बहुत एक्स्ट्रा ऑर्डिनरी आपने बताया। तो सर आप ये मुझे शेयर कर दें तो मैं इसको एक्सप्लेन कर दूंगा मैं किसी सेशन में। मैं रेडी हूँ। और हमारे बीच में सर मेरी गाइड डॉक्टर केवी आशा मैडम हैं। वो केरला की हैं मैडम, और बहुत एक्सपर्ट है इस सब चीज में। अभी मैंने देखा कि पार्टिसिपेंट्स में मैडम भी हैं। तो मैं मैडम को बुलाना चाहूंगा कि मैडम भी कुछ शेयर करें हमारे बीच में।
वेलकम 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 आशा जी।
मैडम आर
Namaste.
यू रेडी? यस madam, now you can share your views and whatever you have experience about animal bites, something like that. I think she is not comfortable now. I think
Now
so.
what?
Okay. Yes madam, थोड़ा शेयर करिए मैडम अपना एक्सपीरियंस थोड़ा बहुत। मैडम आर यू कंफर्टेबल और नॉट?
I can hear you, sir. Can you hear me?
Yes, yes, voice is clear madam. Voice is your voice is clear.
Yeah. So, in my opinion, what the time allotted is, it's a very superficial one. If you are simply saying animal bites,
Yes madam.
but if it is to be a little bit specific, then that will be much more helpful for the medical officers.
Yes
And
madam.
again, when it comes to different topic, it needs a lot of time to dedicate for each and every topic. So I think if it is too much superficial, I feel that. I feel when we are handling cases, especially starting the cases, Dr. Nitin Normalia, my student, he was my student, and he shared his experience. And that is for a dissertation work, we allowed only for mild cases to attend. But we are
Yes madam.
attending the moderate and severe cases also. The most important point when an Ayurvedic physician is handling is majority of the drugs that we are giving orally or through other natural orifices, not as an IV. So when it comes to after a systemic circulation symptoms are manifested, then it will be much more difficult. But before that itself, we can see rightly pointed out by sir that 50% of the snake bite only actually shows a real poisonous bite effect. So it is the doctors can easily handle in such situation, but the only thing is that we have to understand which one is severe and how to follow up that one. And the most important WHO guideline that itself is very important to every snake bite, whether it is poisonous or non-poisonous. If you are not very sure about that one, 24 hours observations are required. And when it comes to again, that is again WHO and all international standard contraindicate tourniquets. but to me, it is generally to public. When it comes to the actual, what is the actual tourniquet, nobody knows. That is a common public does not know. So they will tie up here and there and come to us. The real tourniquet that we are means wherever there is a single bond, there only we can give a tourniquet, and only venous circulation only has to be obstructed. That has to be taken care. And every 10 minutes we have to change the position of the tourniquet by applying another tourniquet just over that area. And again, tourniquet can be applicable only for extremities. So in a place like India, means when doctors are at remote area, if a person has to be transported from a remote area to doctor, then in that sense tourniquet is necessary. That I am not only myself, it is the opinion, all the modern medical doctors who are handling regular snake bite during in the village from the that are receiving cases from village area, they are also saying like the same thing, because tourniquet is in that sense it is well and good. But those who are handling the cases means the villagers, they may be using it wherever there is double bond, there you are making a tourniquet, and the ligature material will be mostly of a coir rope, too tighten or plastic rope. That means even arterial circulation will be obstructed, and so most of the time it will become a numb situation. Otherwise, in Ayurveda, you can handle that condition. So that means even if you are getting a half an hour time before starting the systemic symptoms, then we can apply Ayurvedic medicine safely through all the means through different routes, not only oral but through nostrils, ears, and through umbilical cord also, and for through anal also you can apply. So such things can be given in such situations. So that is the thing that I have to say. And again, when it comes to the cobra bite, means elapid bite, cobra and crate, and viper bite, it is different. But sometimes the patient cannot recognize it properly. That a doctor can easily recognize by simply just checking the concerned area and route, and means the bite, looking at the bite site itself. Because in elapid it will be perpendicularly given, and some simply a pinpointed bite mark can be seen. Whereas in viperidae, almost all the members, they will give a slanting type of, means oblique type of bite, because of their peculiarity in their fangs itself, because the fangs can be foldable, isn't so it is almost in 45-degree angle they will give a bite, and that has to be noted very well. And when it comes to Ayurvedic literature, when you are interpreting, sometimes it is even the sadhya etc are mentioning. So one bite is it is well means it is sadhya, and four bite it is asadhya. Actually, where comes this four bite? So this 4 marks will be there, means that means it is simply only the in the upper fangs, means upper level only the canine tooth are converted into fangs. But if 4 marks are seen, you can say that the bite is that much stronger. That means lower jaw and upper jaw are together pressed. That means the insertion will be in a deeper sense, and the poison will be injected to a deeper level, and cases has to be handled in such a way that has to be noted. And to me, this 20-minute WBC experimentation is that much helpful. We are doing it from the very beginning, initially starting in the 15 minutes, every 15 minutes, and then it goes to 30 minutes, then hourly, then second hour, like that. If sometimes it may continue even up to 24 hours. Such a observation, if you are giving in viper bite, it can be seen. And generally, Ayurveda says all the Viperidae family, they are Paithika means important. And then it is comes to Darvikara, it is Swadika, like that. But the thing is that if you are considering the learning that aspect, and considering the modern aspect also, that is the neurotoxic and hemotoxic symptoms can be seen in both the snakes. and nowadays the ophiologist, that means snake specialists, they are saying that even the geographical situation, climates, and even the sense means the emotions of the snake also is playing a vital role in determining the combination levels of the snake venom itself, because snake venom is not one entity, it is a mixture of a lot of proteins. And so in almost all the snakes, you will get the hemotoxic as well as neurotoxic components are there. So depending upon even the emotions and even as climate, sometimes you can get a hemotoxic effect in cobra venom also, and in viper venom the same way, the neurotoxic effect also, the same thing is, that can be seen. So this is the condition that we are observing. So every time we have to observe continuously and evaluate the patient, then only we can determine go for a determination of what medicine has to be given. And another thing that I have to supplement what Dr. Nitin Normale has mentioned, that is Vilyadi Gulika, he has praised a lot. It is right. It is but nobody, those who are seriously handling snake bite, they are not using the market sample. And the Vilyadi Gulika, that in our college also we are using it, that the material that we are preparing. So minimum 30 hours grinding is that much necessary. Now in the condition of mechanization, it can be, tablet can be made easily, that, but that is not the thing. In grinding means, that means that nanoparticles will be, means particles will be of lower size and the absorption will be much more. And even our in vitro studies are also supporting that the 30-hour, 100-hour, 120 hours grinded material of Vilyadi Agada, if you are using, then that will be much more helpful and speedier action can be obtained. So I think almost all the Vaidyas are doing that by themselves. We people in colleges also, we are preparing medicines in our own unit, and that is using for our patients. It's not a market available sample. And in the first follow-up after the even discharge of the patient also, we are giving the medicine from our own unit. We are not allowing them to use the market samples. So so many things that we have to learn about the things when you are using Vilyadi Agada. And when it comes to the scorpion sting, that is the first point, that is not only of anything oral medicine, the Dashanga or Vilyadi or anything like that, but instead of that one is the pain management is the first criteria. So almost Dhara or Dhuba is the first priority that we have to use. And so any kind of, so many Dhara and Dhubas were mentioned. So that will be much more beneficial than any other oral medicine in the beginning stage. So that has to be conducted from the very beginning itself. Especially very common one is Saksharalavana Dhara is the, that we can use, that is very important. And another one is Dhupa also with the what we are calling small Vilyadi, Cheriya Vilyadi in Malayalam. That is in Malayalam text only that yoga is available, and that is also for Dhuba it is using. And so many other drugs are also, but pain management is much more important. If you are giving simply oral medicine, sometimes pain will not subside immediately. If the pain is not subsided, you cannot handle the patient also. A patient will easily be discharged and they will run away from us also. So that is the point that I have to mention. But in some cases where whether the bite itself is a snake bite or anything else, means we have to take such conditions very carefully. Means rigorous follow-up is necessary to find out what and all things are developing. So these are the things that I have to supplement. But this is not a sufficient time for explaining all these things in one thing. I think if you are splitting into different animal bites, then it will be much more easier to understand for handling such cases for medical officers. Thank you, sir.
Thank you, madam, for giving your lots of information regarding animal bite management. And thank you for guiding me for whatever I am today due to you, for you, by you. So
No,
thank you,
again,
madam.
you have to again work on. It is not sufficient